Assalamu alaikum everyone. Thank you all for coming today. I'm very, very excited for this event and very lucky to have an event like this as well. Alhamdulillah. We are joined by a very honorable Sheikh as well, who's come all the way from America. And he's been, I'm not even, it's the most amazing tour Brisbane has probably ever had, with so many events in such a small amount of time. I'm surprised he's here right now and he's smiling and he's getting through this event. But inshallah, sorry, I'm just gonna. I just So alhamdulillah, Dr. Hatem has come all the way from America. As I've said, he sits on the American Fatwa Council as well, and he currently practices as a pediatrician at the moment as well. And so alhamdulillah, thank you to IMA today, who have been funded this whole tour as well, and we couldn't do this tour without them. And Human Appeal have kindly sponsored this event today as well, so that we can host it at UQ and provide you with the refreshments as well. So we're quickly going to do an intro about IMA as well, and just for the structure for today, so we've kind of decided to switch it up a little bit and kind of extract all the knowledge that Dr. Hatem has as well. So we're going to kind of go into the Q&A kind of forum straight away, and we'll go through, obviously guys filled out a form as well, so we'll go through those forms as well, and so the questions you submitted on that form as well, and yeah, we'll try and extract all the knowledge that Dr. Hatem has. So to start off, we just want to thank IMA as well. As I've said, we'll watch a quick video about IMA. So now I want to kindly invite Dr. Asif to give a quick summary about IMA and also how you can claim some points as well for today's event. Okay, welcome Dr. Asif.
Assalamu alaikum everyone. My name is Asif. I'm one of the GPs. I practice in the outskirts of Brisbane, and I am Queensland coordinator for professional development for IMA. So, Jazakallah khair. This shall I continue? Playing for this video, so we learned the basic introduction about IMA. So, IMA has been. It has become, alhamdulillah, the largest organization of Muslim healthcare professionals in Australia. And it is a body which has already united all the regional and statewide bodies of Islamic medical associations and healthcare professional associations. There's a multitude of initiatives which IMA runs and leads, and it encompasses across all the disciplines of not only medicine but also the allied health and healthcare professionals, alhamdulillah. You saw some of the initiatives. Most recent one was blood donation drive, which was nationwide, and alhamdulillah there were over 30 or 32 venues nationally where there was a blood donation drive. And alhamdulillah in Queensland we were able to run that on 14 mosques across the breadth and width of Queensland for blood donation drive. Similarly, other activity which is the continuous professional development, there are courses for that one. There was a large national course, leadership course in June in Brisbane, which was run by the national body. And also there are online activities. So it is open to all healthcare professionals, allied health professionals. You're welcome, join our hands and join the initiative.
So I just want to take a moment as well and thank Human Appeal for their sponsorship for this event tonight as well. Without them, the tour with Dr. Hatem and along with this event wouldn't be possible today. Before we continue with the forum and the Q&A, I thought we'd ask Dr. Hatem just to introduce himself from the doctor perspective as well and see how he came to his journey to becoming a pediatrician today. And let's hear from Dr. Hatem now.
My mic is working. So, Bismillah, alhamdulillah, salatu wassalamu ala rasulillah wa alihi wa sahbihi wa man wala, thumma amma ba'd, proceed. Sheikh Abdullah ibn Hamid from Zaytuna College in California just asked me this question, and he felt that my answer was a little bit too bland because I chose pediatrics because my sheikh was a pediatrician. So it was not, the greatest reason to become a pediatrician, but I liked the specialty because my sheikh was a pediatrician, and in addition to this, I got good marks in my rotation in pediatrics, so I figured not a bad idea. So that's why I went into pediatrics. And I practice pediatric hospital medicine because it suits my sort of lifestyle. So we do 24-hour shifts, and we do like 8 shifts a month, and that's full time for us. So it leaves me like 22 days a month to just do whatever I need to do. And what else? I guess that's it.
Perfect. Thank you so much, Dr. Hatem. So we had a total of about 8 different categories of questions that came through in the form. So it's going to be difficult to get through that in the 2 hours, but we'll try our best to keep it as concise as possible. So the first kind of questions we had were all just about generic medical ethics. So I'm trying to get the questions up. So it's going to try and ask a generic question. Hopefully, you can present all this knowledge as well, inshallah. So the first question we have was about how can we deal with performance enhancement drugs, prescribing and dispensing for TIT, bodybuilding, and longevity use, and what does Islam teach us about dealing with this issue and the financial gain made from this?
Alhamdulillah, yeah, so I'm not an expert on performance-enhancing drugs, and like those of you who are physicians outside of your specialty, you probably want to be careful, and also even within your specialty, you still want to be careful because you don't know everything about your specialty. So I will predominantly answer these questions from my sort of Muslim jurist perspective, not medical expert perspective. So if you ask me from like a juristic viewpoint about any drug, there are certain things that we cannot prescribe because they are haram inherently. And aside from those things, everything else depends on the balance, the harm or the harm-benefit ratio. So once the physician and certainly the experts have determined that the harm-benefit ratio is favorable, then they are allowed to prescribe those medications. So what are the things that we cannot prescribe? We cannot prescribe khamr. And that is basically not necessarily alcohol, but khamr, anything that is intoxicant, anything that would cause intoxication in large amounts is forbidden, even small amounts. It's a legal maxim. It's a statement of the Prophet ﷺ, and a legal maxim. ما أسكر كثيره فقليله حرام. That which would intoxicate you in large amounts is forbidden in any amount. So we can't prescribe anything that will intoxicate in large amounts. What does that mean in terms of medicines that would have alcohol in them? You will have to determine, like as a Muslim basically scientist or as a Muslim pharmacist, you try as much as you can to avoid alcohol. But as a Muslim provider who has medications who has different types of medications, you are allowed to prescribe medications that have alcohol if they will not intoxicate you in large amounts. If the medicine, like certain mouthwashes for instance, may intoxicate you in large amounts, and some other medicines that would have a large percentage of alcohol may intoxicate you if you consume them in large amounts, but any medicine that would not intoxicate you in large amounts would not be considered khamr, and you may be allowed to prescribe it. What about sort of filthy or impurities, things that have impure substances? Again, if you are a Muslim physician a Muslim pharmacist, or like if you work in a pharmaceutical company, or you're making those medications, then you may want, as a Muslim, to avoid pork and anything that is basically a byproduct of anything that is najis or impure in your work. If there are alternatives, keep in mind that when it comes to at-tadawi bin-najasat, or using impurities for medical purposes, we have two madhahib that would allow this to a great extent. The Hanafis and Shafi'is would allow using impurities for medical purposes to a great extent. The Malikis and Hanbalis are stricter in this regard, although the Malikis may say topical, if a topical treatment will save life, then it would be okay, even if it is impure. But since they say al-marad madhinnat al-tarakhus, so we show the ease of Islam, and we use dispensations as much as possible when it comes to health and sickness, because if someone is sick, you want to help them as much as possible, and that would warrant, ease. المشقة تجلب التيسير is a قاعدة فقهية. It's a legal maxim. Hardship begets facility, and marad, disease, is certainly a hardship. So we will use the Hanafi and Shafi'i perspective in this regard, and we will not be strict with using impurities for medical purposes. So basically, it comes down to the prohibition of using khamr. In the past, people used khamr for tadawi. That was not allowable for us Muslims. And if someone says that, I have a kidney disease and that's why I drink beer, that is not allowable for us as Muslims. The Prophet ﷺ, when he was asked what about using it for dawa, he said it's not dawa, it is da. It is not cure, it is disease. And that's a very accurate description. So going back to the performance-enhancing drugs, so performance-enhancing drugs, they are not intoxicant, they are not even impure, I guess. So it falls under the third category, darar, the harm. And the harm-benefit ratio is determined by the experts. I'm personally not an expert in this regard, so I would tell you, consult the experts. If they determine that the harm-benefit ratio is favorable, then you may prescribe them.
Great. So does this kind of include like medical cannabis and gelatin-containing products as well? Kind of use the same kind of principles for that?
So when it comes to medical cannabis, let's do the gelatin first. So gelatin, because it's impurity, gelatin is different from other byproducts because gelatin does not transform chemically. It stays as, you can trace it back to the source, like porcine or bovine, etc. So you can trace it back. Gelatin in particular, gelatin in particular, you want to avoid it if there are alternatives. So if the gelatin comes from impure sources, you try to avoid it if there are alternatives. Of course, in food, you will avoid it. So if you have like food containing gelatin, you will avoid it as a Muslim. But as a prescriber, as a provider, if you don't have alternatives to the medicine, you could still use it even if it comes from impure sources, even if it comes from pork. The second question is about cannabis and marijuana, the use of medical marijuana. We've been using morphine forever. So what is so different about marijuana? Marijuana, I guess it makes you a little bit less comfortable because you're using morphine and it sort of looks more more conventional It's less, it's not a street name. It's like it looks like a little bit more professional to use morphine. But if it is determined that medical marijuana has that harm-benefit ratio, and the harm-benefit ratio has, when we talk about the harm-benefit ratio, we're talking about within the particular circumstance or within the particular application. So if you have like a cancer patient, for instance, who has chronic pain and marijuana helps them, and it is determined that this would be the better medicine for them versus using like synthetic opioid, for instance, or just opioids. Then it would be okay. It's just a medicine, as a medicine. Of course, marijuana is forbidden. Recreational marijuana is forbidden in Islam. Anything that would cloud the intellect, in Islam, and that's something that every Muslim provider has to be aware of. The maqasid al-sharia al-kubra are the preservation of religion, spirituality, the preservation of life, the preservation of the intellect, the preservation of lineage, the preservation of wealth, property, wealth. So, حفظ الدين, النفس, العقل, النسل, and al-ard within nasl, honor also within nasl, or you could make it the sixth one, and finally, al-mal. So, given that حفظ al-aql actually features very highly on the order of Islamic objectives, we should not use anything that will cloud the mind. We should not use anything that will cloud the mind. So anything, any recreational drugs will be forbidden. Their use in medicine will be determined by the harm-benefit ratio. If their benefit outweighs their harm, then they may be used. Just like we have used morphine forever, we could use it as well. And you try to mitigate the side effects as much as possible by, prescribing it within reason, and ensuring also that you want to be forthcoming with the patient in terms of the abuse of the medicine and the consequences of abuse, provide sufficient anticipatory guidance, and you're not doing this basically just to make money, or to certainly if you're doing this to make money, then that's quite criminal. But you're doing it for the best interest of the patient. If you're doing it for the best interest of the patient and you're making the patient aware of all the side effects, then there is no problem.
Okay, great. So that's all the questions we had on the forms. I'm just going to open up to the floor now and see if anyone had any other questions about medication use.
That's everything you had? You had like a whole...
Yeah, just on medications. Just on medications.
Oh.
You thought you could get away early. Yeah, so we'll try and just keep the questions focused on medications, and then we'll move on to the next topic after this.
Assalamu alaikum, Sheikh. This is Asif again. May Allah bless you for enlightening us with the Islamic perspective on medicinal cannabis. Just seeking further clarification about the use of medicinal cannabis in medical perspective. And I guess you assess the risk-benefit ratio and you prescribe the component of which is THC, or tetrahydrocannabidiol. And then it is up to the patient. And the patient uses that dose more than what is prescribed or intended. And unfortunately, then they do reach that spectrum where it starts clouding or impacting or impairing their intellect and consciousness, and it leads to psychosis. It is a contested and disputed kind of practice here in Australia, at least. There is a widespread rise in the use of medicinal cannabis, and there are a variety of the clinics and the clinic practitioners who are prescribing it, and some with very least supervision, and they just do some online assessments and then leave it to patient. The question is, my intention as a clinician is to actually benefit the patient and prescribe a certain dose where I feel would not cloud their intellect and consciousness. But if the patient uses it more than the prescription and ends up in that kind of situation, I guess where do I stand in that situation?
Well, the patient can buy cannabis, like in the U.S., for instance, you could go buy recreational cannabis wherever you want, whenever you want. And most of the states, I believe, at least in New Jersey, where I come from, the dispensaries, you have dispensaries that are medical only, or ones that are medical and recreational, and ones that are recreational. So So if you go to the medical dispensary, they'll ask you for the dose, the dose, and they'll take the prescription. The dispensary next door will give you everything you want without anything you want. All the edibles, all this sort of inhaled stuff, and so I don't think it is your responsibility. Your responsibility is to provide sufficient anticipatory guidance, and your responsibility is, if there is an alternative that is better, is to recommend the better alternative. To recommend the better alternative, to provide enough anticipatory guidance. And if the patient abuses the medicine, the patient can also abuse, morphine, can abuse tramadol, can abuse whatever it is.
Great. Well, there any question with that? Sorry, Dr. Did you go ahead?
Assalamu alaikum. It's Dr. Abid. I think we can move forward from CBD for now. If I can ask you about gender, issues, the medications. Children, they are assessed by these pediatrician and psychiatrist and the whole team, and they start them on the medications, hormonal therapies, and they come to us as the GPs, So what is our role?
So basically, you cannot transition from one sex to another in Islam, and all of the sort of sex transitioning medications or procedures, medical interventions would be completely prohibited and disallowed unless you have disturbance. You have when it comes to sex, you have 4 different layers. You have the chromosomal layer, you have the gonadal layer, you have the internal genitalia, you have the external genitalia. And if you don't have any disruption in any this axis from chromosomal to gonadal to internal and external genitals, if you don't have any disruption and you are a full-blown male, a full-blown female, then it's not allowable to change your sex, and it's not possible to change your sex, but it's also not allowable in Islam. Islam condemns tashabbuh الرجال بالنساء النساء بالرجال. It condemns the mere imitation. But Islam is very, very strict on basically muddying the border between the 2 genders. We want to have 2 genders because they have important complementary roles, and once you have disrupted that border, then the society may be in great danger. So as a Muslim physician, you are not allowed to prescribe those medications unless the patient has like an issue, like the biological, not behavioral, biological indication, not simply a matter of preference. Yeah.
Sorry, I'm not a medical person, so I'm a question from just a field perspective. Can you explain better the distinction between Hammer as an intoxicant on the one hand and something which clouds your judgment on the other hand?
Both of them will be forbidden because something that clouds your judgment will still be forbidden. Anything by consensus of Muslim scholars, anything that will cloud your intellect, that will impair your judgment, cloud your thinking, affect your intellect would be forbidden. However, khamr is so you could say that you will make like by analogical reasoning you will equate between khamr and all those things that will cloud your thought and impair your judgment. But most of the scholars don't say that. Most of the scholars say that there are still differences. I'm quite sure that you don't have hudud in Australia, so you probably will not flog people who drink and stuff. But if there is a Muslim country that does that, they will not flog someone who used cannabis. They may punish them, but it will not be the same punishment as khamr. It will not be the same had or punishment as khamr. So there are distinctions. The distinctions do not mean that these sort of substances are permissible. They're all haram. And they're all haram based on their impairment of the judgment, their clouding of the mind. They're all haram. But khamra has a little bit more distinction. It's more sort of strictly prohibited because it comes in the Quran and the Sunnah of the Prophet ﷺ, and it will be hard to say that something that comes directly from the Quran and Sunnah. Well, cocaine is maybe worse than khamr. Maybe worse than khamr. Some of the scholars will say that you can use the A4 shirai analogy, which is qiyas al-awla, the sort of stronger analogy, to say that this is not only khamr, this is worse than khamr, therefore you apply the same punishment. The majority of Muslim scholars will not say that. They will say cocaine would be haram, would be punishable, but not with the same punishment as khamr.
We'll just do one more question. There's a hand up. We'll go with you as the last question of the line. I'll move on to the next topic after this, and then we'll do more floor questions right at the end of the session. Granted, we have time, inshallah.
Assalamualaikum warahmatullahi wabarakatuh. Just in regards to the medication for transition gender, like I'm a GP, so I'm not in position to decide whether they're having the medication or not. So let's say a patient came in and they've seen the pediatrician or gender clinic, and they were prescribed the medication hormonal treatment. So what do I do? I mean, my usual practice is I tell them that I'm sorry, I don't do this. I can refer to someone who can do this, or you have to see your endocrinologist back. But in terms of myself, so am I allowed to prescribe the dose that being decided by the specialist, or should I just completely avoid it?
Yeah, so gender transition medications, a Muslim physician should not prescribe them. A Muslim physician, keep in mind that we've discussed this last year at the AMJA conference on medical interventions, and you are allowed to treat transgender patients. Of course, you are allowed to treat but not in the gender transition sort of treatments. So, but if a transgender patient came to you with artificial vagina, for instance, like a condition in the artificial vagina, are you allowed to treat that condition? Yes, you are allowed to treat that condition, because here you're not basically changing anything. You're just addressing a problem that they have. You're not the one who did the surgery. You're not the one who prescribed the hormones. You are just addressing a problem the patient has. However, when it comes to prescribing medicines that are used for transition, that would be impermissible. It will only be, so a Muslim physician has to do his best اتقوا الله ما استطعتم, fear Allah as much as you can. A Muslim physician has to do his best to recuse himself from treating these particular conditions. Now, there may be a question, and we had considered this because in Canada, there may be at one point, they may, I guess, force them at one point to prescribe, to assist with suicide. And that would be quite difficult for a Muslim physician to do. Like very, very sort of problematic, like a severe ethical dilemma. But let us say they forced it on them and then they would lose their license. We're imagining here. We're imagining that they may lose their license if they don't provide this treatment. Then we discussed this, and then we said, when that happens, let's address it, because there will always be المشقة تجلب التيسير. إذا ضاق الأمر اتسع. When matters become too difficult, they have to, ease is warranted. You have to bring about ease. So we may consider this if the Muslim physician will suffer the loss of their license. But if it's just suffering the loss of one patient or the loss of a little bit of income, then that would not be permissible. Still, yeah.
Perfect. Okay. So the next kind of topic, it's a good segue to the questions we've just had, was about treating patients that are looking to switch genders, and just discussions about sexuality and kind of weighing that up, with our Islamic values, but also being a good doctor as well, and doing what's in the best interest of the patient. So that was kind of what the next topic was about. Yeah.
Okay.
Seems like okay. Let's look it. Yeah, I think another kind of another kind of segue was into treating patients of the opposite gender as well. That was a big question as well in the form.
Treating a patient of the opposite gender?
Yeah.
Well, in general, that is not. It is not. It's not your responsibility to choose the patient. It's the patient's responsibility to choose the doctor. So, like the Muslim patient is advised, given that you have comparable, the doctors have comparable skills, and this is important. Given that the doctors have comparable skills, then you should choose a same-sex doctor over an opposite-sex doctor if they have comparable skills. But that's the responsibility of the patient. The doctor will treat whoever comes to them. And we all know that, in medicine, that there is room for this. And there are many hadith, Rubayya and Atiyya, and some of the even wives of the Prophet ﷺ, Aisha, used to go out to the battlefield, and they used to go out to tend to the wounded. Now you may say that this is darura, a necessity, it's war. No, and it's not a necessity, because you could have used a couple of men to do this. Like it's not like they took all the men to fight. There were still men that could be used for these purposes. So there is like room for male physicians treating females and female physicians treating males. But it is the patient, the Muslim patient, is advised to go to a same-sex physician if they have comparable skills.
Thank you so much. So if I move on to the next topic, then I think we've covered the gender and sexuality topic quite comprehensively. The topic of end-of-life care was a big question on the forums as well. And more specifically, voluntary assisted dying. So a lot of registrants ask, as physicians, how can we and kind of handle the discussions around voluntary assisted dying and euthanasia.
Assisted
as well.
dying?
Yeah, and euthanasia as well.
Well, do you guys have this here? Oh. So are you required? You have to do it? Okay, then you should not.
I have to refer them to someone else.
Refer. That's fine. Yeah, refer to someone else. But no, you should not participate in this. There is a huge difference. Islam actually is pretty flexible in this regard. In fact, most of so sometimes when people don't follow divine guidance, they just keep on shifting from like hot to cold, cold, hot. So Islam actually is very moderate in this regard. Islam does not require patients who are terminally ill to continue their treatment. So you can let the patient die naturally, and you can provide comfort care to allow the patient to die comfortably. But not assisted dying, not euthanasia, none of that stuff. But Islam would not force you to take medicine, and almost 99% of the time when people call me about end-of-life fatawa, I tell them, remove the life support. There is no need to keep it. Why are you keeping it? I have to tell you this story about myself because maybe it will impress you a little bit to understand this. So I lost my spleen in a car accident, and they flew me to a tertiary care center, and they took my spleen out, and then I woke up. I was intubated, and for some time no one was paying attention to me, and when you're intubated, you can't scream, and you're paralyzed, and you have this thing down your throat. This was like a horrific feeling, just like a horrific, like any torture camp who cannot do this. So you have to understand that. So why are we doing this to the patients? Sometimes Muslims think that you have to do everything you can. That's Catholic. That is not Islamic. That is, whoever said that this is Islam. The Sahaba refused treatment sometimes. And what is the ruling of seeking medicine and medical intervention in Islam? It's recommended. Some of the scholars had said obligatory. But according to the four madhahib, it is not obligatory. It's just recommended. And Imam Ahmad himself said, it's better not to, to not seek treatment if this will show, but anyway, just try to remember the mainstream position within Islamic jurisprudence. The mainstream position within Islamic jurisprudence, and that's the agreement of the four madhahib, is seeking treatment is recommended, not obligatory. Now, a few Shafi'is and Hanbalis, earlier Shafi'is and Hanbalis, said that sometimes it's obligatory. And that's correct. In fact, Imam Taymiyyah said it could be any one of the 5 legal categories. It could be wajib, it could be haram, it could be mubah, makruh, mustahab, anything. It could be anything, depending on circumstances, depending on the condition, depending on circumstances. So treatment is not obligatory all the time. Now, the International Islamic Fiqh Academy looked at this and said, well, some of our earlier scholars said treatment is obligatory, so we will consider it obligatory in certain scenarios of sort of like emergency interventions. If someone is bleeding, for instance, stopping the bleeding is obligatory. Communicable diseases, if it would cause harm to the society, then it's obligatory to treat it, to curb harm to the society. Diseases that would cause a great incapacity, that will incapacitate you and there is treatment. And to summarize this, if you want, like harmful diseases that have harmful diseases that can be treated with safe medications. داء مأمون, دواء مضر, داء مأمون, harmful disease, safe medicine. If you have diabetes and there is insulin, it would be obligatory not because treatment in general is obligatory, because the Prophet said, La darar wa la dirar, there should be no harm or reciprocation of harm. And if ignoring treatment will cause you harm, the Prophet said you should not harm yourself. You should not harm yourself. So we'll consider it obligatory in cases like this. But when you have an irreversible terminal illness and you keep on forcing the patient to seek treatment or take treatment, or when you have someone on a vent for 2 months or something, like, no, treatment is not obligatory in those cases. So usually when people call me to ask about, taking off the life support, I tell them, have 3 trustworthy physicians. 3 trustworthy physicians. And why 3? Because that's the number they gave, the Islamic International Fiqh Academy gave to basically, they wanted to be a little bit more careful because of the scare. You know that movie Coma, I guess, much older people may remember that. Who's much older here? There's like a movie called Coma where it was about like evil doctors harvesting organs from the patients and so on and so forth. So I guess some of those scholars may have watched the movie. And they felt that we have to just be cautious and to protect the patients. So they require 3 doctors to testify that the condition is irreversible, and if 3 doctors testify that this patient, the condition of this patient is irreversible, then you take off the life support and you stop the treatment. There used to be a lady by the name of Terry Schiavo in Florida who was in a persistent vegetative state for 20 years. 20 years. Do you know what that means? Like, you're bedridden for 20 years. There is no input or output. You're being fed through the tube. You're not on a vent. You can actually be like you're breathing on your own. So the brain stem is responsible for the most sort of essential functions, cardiopulmonary functions. So her brain stem was fine, but the insult was to the cortex. So brain stem is fine, she's breathing on her own, nothing, but there is no input, there is no output. She has like a feeding tube, and she was for 20 years bedridden. So her husband wanted to end this, wanted to stop the artificial nutrition, and her parents did not want to stop the artificial nutrition. It was a big deal in America at the time. So at AMJA, we wrote something about it. We were asked to write something about it, and even within AMJA, there was a little bit of disagreement because of conceptualization. Before you can make a judgment, you have to conceptualize the condition. You have to conceptualize the matter that at hand. So people who conceptualize artificial nutrition as a form of feeding will naturally say, no, you cannot starve her to death. People who will conceptualize this as a form of treatment, and they understand, what it takes to keep the patient on artificial nutrition for 20 years, will say, you may stop this, you may stop it. So anyway, eventually, eventually they stopped it. But again, at the same time, the problem nowadays, is that medical advancement had made doctors capable of keeping the patients on vents and in persistent vegetative state for years on end. And the thing that they kept on saying, is there any input, they kept on saying, is there any input or output? What is life from an Islamic perspective? What is human life from Islamic perspective? So it is a condition that distinguishes between animals and vegetations or plants by two qualities, ilm, which is idrak, and willful action. Ilm or idrak, that's awareness, that is the input, and then output, willful action. And if there is no input, ilm and idrak, and there is no willful action, we're not going to say that you're not alive, but is this life that you should extend by artificial means? Of course, I don't think so. Of course not. And the thing that is more scary, because they kept on asking the treating neurologist, if she has any input, awareness. And why were they asking if she has any awareness? Because if she has awareness, they wanted to keep her. They wanted to continue because she has awareness. If she has awareness, that would be the most terrifying thing, if she has awareness. Can you imagine being locked into your body for 20 years? So anyway, so we have to be careful to not cause to not cause this torture to people. Yeah.
So just another question on top of that was in regard to organ donation as well, both obviously during life and then end of life as well.
Organ donation. So organ donation still depends on the harm-benefit ratio or the risk-benefit ratio. If organ donation is allowable in Islam, according to the majority of Muslim scholars, organ donation is allowable. Still a matter of disagreement. Was a matter of this, continues to be, will continue to be, but the bodies, the assemblies, the fiqh assemblies in different parts of the Muslim world have declared that organ donation is permissible. But we have this principle, it's an overarching principle, it's the third most important legal maxim, la darar wa la dirar. There should be no harm or reciprocation of harm. So if you're 20 years old and you donate one of your kidneys, most likely you'll start to have issues before what is life expectancy? 80 years? 60 years with one kidney would be a little too much. If you're 40 or more, and I heard this from a nephrologist, like a Harvard nephrologist who came and gave a lecture at our hospital. If you're 40 or more, it may be okay. So, and I'm not saying that you must take this as like basically a hard rule, but you have to also keep in mind the donor and the interest of the donor and the well-being of the donor. So organ donation, if it doesn't cause significant harm, is permissible in Islam, except for organs that carry the genetic code, like like if they will ever basically be transplanted, like ovaries and testicles and stuff like that. And they also said external genitalia should not be, but except for that, the organ donation would be permissible.
Great, thank you. So I might just open up to the floor now about questions regarding end of
There
life
is
care.
there is just this one thing about you said whether alive or dead. If someone is dead, they will certainly need the consent of their guardians, the consent of their relatives. You know, organ donation is permissible, but that does not allow people to harvest organs from people, whether they are living or dead, without their consent. Whether it's advance consent from the patient himself or consent from the family after their death. Yes.
And just online, there's another question about harvesting organs as well after death.
Harvesting organs after death? What's the question?
That's just the question.
Oh. So, yeah, it's permissible. Yeah, permissible if they give consent.
Okay,
Yeah.
great. We might just move on. So, sorry, just any questions to the floor then about...
I'll be great. So someone can do a will, Islamic will, to donate their organs after their death?
Yes, they can. Yes, they can. Muslims should not have a problem with this. And it doesn't matter who receives the organ. It doesn't matter who receives the organ. Because, you know, the Prophet ﷺ said, في كل ذات كبد رطبة صدقة. There is charity, a reward for charity towards every living creature. Every living creature. Kabid ratba, moist liver, which means living creature.
Assalamu alaikum, Sheikh. Jazakallah khair for coming now. Allah bless you.
Allah yabarak feek.
I wanted to ask if you think with organ donation, like medically, people would assume that you're donating their organs to another person. But what if someone was intending to donate their organs for science, like for people to study and things like that? Like as students, we go and we see cadavers and things like that. Are people able to donate their own organs for that sake?
That's fine. If they want to donate their organ for like scientific research, that is fine. I mean, if after their death, I mean, like, yeah.
Assalamu alaikum, Sheikh. My name is Momin. I'm a palliative care physician. Just a question about the assisted suicide or volunteer assisted dying again. One of the requirements here in Queensland is the patient has to have a prognosis of less than 12 months. And as a physician, I frequently get that request of assessing prognosis, an official request from the volunteer assisted dying team. Do you think, in your opinion, your patient has less than 12 months? Is by answering that question somehow I'm contributing to the volunteer assisted dying? Can we avoid it? Or?
It's not your responsibility. Yeah, you're providing an honest assessment of the condition of the patient. It's not your responsibility what they will do with that information afterwards.
Are there any questions from the ladies? I'd just like to keep the gender balance, inshallah.
Assalamu alaikum, Sheikh. I was just wondering, what are your thoughts for cord blood stem cell storage? Is it permissible?
I didn't hear this.
Oh, your thoughts about cord blood stem storage. So the babies, they hold the parents.
Umbilical cord storage. Okay, for stem cell for
umbilical cord.
Yeah, just to store the umbilical cord for stem cells, or yeah, well, there's nothing wrong with that. You know, nothing wrong with that. Even, you know, spontaneously aborted fetuses, you could also harvest their stem cells if they are spontaneously aborted. Of course, you cannot basically have babies to harvest the stem cells from, but spontaneously aborted, that's fine.
Assalamu alaikum, Sheikh. I'm going to take you across species. I'm a veterinary doctor, and we're talking about euthanasia, and this is something quite common in veterinary practice, and obviously We've got a different situation where the patient themselves is not giving consent, but we've got the pet parent or the owner, giving that consent. Are there any limitations for what we can practice? Obviously from a fit perspective, I'm calling on your expertise. As a veterinary practitioner, are there any restrictions as to situations where we're not allowed to practice euthanasia? A lot of the time these are for welfare perspectives where treatment options are either not available or they're not financially viable.
So animal euthanasia is permissible. Is permissible. Certainly we know that you don't kill animals for fun. In fact, the Prophet cursed those who take living creatures as a target. So you don't kill animals for fun, or you don't kill animals purposelessly. But animal euthanasia, for whatever purposes the people may have, may be okay. In general, if someone sees an animal suffering, sick and suffering, and they want to euthanize them, that's permissible. But let's say people have a cat, for instance, and the cat is not sick. They should not, of course, euthanize the cat. They should release her, or him, I guess, into the wilderness. But if the cat is sick and they feel that the cat will not be able to fend for herself, and they want to euthanize her, that's fine.
Can you comment from a perspective of a Muslim owner? Some Muslim owners don't want to euthanize their pet. They won't pay for the treatment and they won't do the right thing for their pet, but they never look, we can't euthanize it. Well, where do we stand there?
The owner does not want to euthanize?
Muslim owner doesn't want to euthanize. They think it's wrong, but they won't say let it suffer. They say in the wild, they would just live with a broken leg in the wild, so I'm just going to let them walk on that broken leg.
I mean, there is room for disagreement. Like, there is room for disagreement here. It is permissible, but you can't say it's obligatory to euthanize. Yeah.
Assalamu alaikum, Sheikh. I'm a clinical general pediatrician in Queensland, and I thought I'd just add some comment for the brother on the right hand side who mentioned about being a GP and transgender patients and what should be their approach. In Queensland, last week we have got a ruling that puberty blockers are not allowed by any pediatrician, and no children under 18 are allowed to receive puberty blockers. This is a very common issue, and in the last 10 years I think we are seeing a great number of increasing patients who identify themselves as transgender, and to my experience and knowledge, majority of these children would have some mental health issues in the background, and they come from often very complex psychosocial dynamics. They often have other neurodiversity associated with that. So as a GP, I do not think you should ever take that responsibility, refer to the specialist. And even as a pediatrician, we manage them but predominantly attend to the mental health. And if needed, we give them the offer for a gender clinic that is based in one of the main tertiary hospitals in Brisbane. As a general pediatrician, we often have quite conflicts with that team, because whoever goes to the treatment, in my opinion, always comes out with some puberty blockers of some sort. So we have some own opinion, personal opinion. We, as a general pediatrician, very honest and open to express to those families, and not every family parents would go ahead that path, but we leave it up to them, whether, because ultimately it's their child, they make the decision, or the child themselves make the decision when they reach to that certain age. Thank you.
Okay, we'll just do one more question from the floor on this topic, and then we'll move on to the next one.
Anyone else have any questions?
Assalamualaikum.
Waalaikumsalam.
My question was with respect to the palliative care. So in medicine, especially with palliative, and I'm sure many people could add into that as a medical student who's still learning, we've been taught that you're allowed to prescribe medication which can hasten death, so that individual dies from the medication itself in terms of pain. So giving opioids or giving certain pain medication that results in that patient's death if it's a palliative situation. And from an Islamic perspective, would that be okay? Because you're essentially hastening their death.
If the intent and the dosage is not directly meant to hasten the death, it's meant to relieve the pain and the suffering, but they die earlier because of the medicine, I don't think that this is euthanasia. I don't think that this is a problem. This is still comfort care, and you're using the right medicine, the right dose to bring about the desirable outcome, which is relief of pain. If at some point that hastens their death, that is not killing.
Okay, great.
But in general, I just want to tell you that in general, people who use those medications properly in the right dose, it doesn't really, it doesn't hasten death. Yeah.
Okay, great. So we'll just move on to the next topic. It was about reproduction. So we've got some questions about discussions about termination of pregnancy, and kind of more specifically if there has been an anomaly on imaging and investigations, kind of addressing termination in that sense as well.
Okay, so we have a little bit of a discussion among the Muslim scholars about the ensoulment. Ensoulment is called in the secular sort of tradition, I guess, if there is a secular tradition, but they call it personhood. We call it ensoulment, and we have a little bit of discussion about ensoulment. But the majority position is that ensoulment takes place at 120 days post-conception. 120 days post-conception. 120 days post-conception, by the way, is 134 days of gestational age, because gestational age is counted from the first day of last period. First day of the last period happens 2 weeks prior to conception. So this is something that you have to keep in mind when you advise the Muslim patients, because that causes confusion. So we're talking about 134 days of gestational age. Earlier, the earlier scholars were a little bit more liberal with permitting abortion than the later scholars. The earlier scholars, so the Malikis forbid it from day one, and from day zero. Forbid even the expulsion of semen from the canal. So the Malikis are the strictest in this regard. Some Hanafis and Shafa'is also forbid it. However, the dominant position among the Hanafis and Shafa'is is to permit it with mutual agreement of the two parents, or according to some position within the Hanafis, the mother only is required to, or the father is not even consulted, I guess. But that's an interesting position, by the way. Or maybe we should say that the father's consent is not required. And then the Shafi'i and then the Hanbalis, they say up to 40 days is permissible, and between past 40 days is not permissible. Then we have up to 40 days, up to 120 days. After 120 days, and that is when the majority of Muslim scholars believe ensoulment takes place, then it is prohibited by agreement, by consensus, unless the pregnancy risks the mother's life or health in significant major ways. Then if the pregnancy causes, puts the mother's health in significant major ways at risk, then abortion is permissible at any time, because you don't sacrifice the branch, you don't sacrifice the trunk to protect the branch, or the root to protect the branch. You sacrifice the branch to protect the root. Now, aside from the mother's health, if this is about the baby, the current fatwa of the scholars and the different fiqh assemblies are stricter. And they are stricter because they do see sonograms and babies moving inside, and they feel a little bit sort of more guilt to be permissive with abortion. So what they say is, in the first 40 days, it is permissible with upon mutual agreement of the parents. Within the first 40 days, abortion is permissible upon mutual agreement of the parents. After 120 days, it's never permissible unless it will cause harm to the mother. It will endanger the mother's life. Between 40 and 120 days, which is 134 of gestational age, it is permissible if, and that is the language they used, there is a confirmed diagnosis incompatible with dignified life. So certain trisomies, certain things that are incompatible with dignified life. The life of the baby will be a life of suffering and pain. Then they would allow it between 40 to 120. They also, when the war in Bosnia was taking place, and there used to be Allah al-Musta'an. But they also said that abortion would be permitted if the child is a product of rape between 40 and 120 days. If the fetus is a product of rape between 40 and 120 days. Of course, if anything that makes it permitted between 40 and 120, it would be permitted before 40, because they already said before 40, mutual agreement of the parents would make it permitted. So that is basically the discussion briefly, and that is the trend of contemporary scholars. Less than 40, mutual agreement of the parents. But the advice here would be, and forgive me because I have sort of my area of interest is jurisprudence, but certainly would we advise abortion? No, we don't advise abortion, and it's just that we're talking here about the rulings. So less than 40, mutual agreement of the parents. More than 120, never, unless the mother's life is in danger. Between 40 to 120, if the baby's life will be a life of suffering, they may have abortion.
Can I just clarify, please? Before 40, you mean for any reason?
It's mutual agreement of the parents, but it is expected that there will be a reason. I mean, some of the scholars, and I have said this, some of the scholars prohibited from day one. The Malikis prohibited from day one. Some Hanafis and Shafi'is prohibited from day one. So many Muslim scholars prohibited from day one, from day zero. So after the act of intimacy, you can't do anything, according to many scholars. So this is a controversial issue. But when they say mutual agreement of the parents before 40, they are certainly assuming that this mutual agreement of the parents was based on some reason, but they don't specify the reasons for the parents. They don't require certain reasons. They leave it for the parents to decide based on their circumstances and their values. Yes?
Is there any reference from Quran and Sunnah regarding permission of abortion?
Regarding the termination?
Yeah.
No, there is no reference per se from the Quran and Sunnah regarding termination. Yeah, that's the fiqh discussion among the scholars.
Great, well, do I just continue on to questions from the floor? Yeah, we'll go Dr. Asif. Sorry, we'll just get the mic for you.
Assalamu alaikum, Jazakallah Shaykh. It's very engaging and enlightening sessions. My question is regarding a couple of practices in artificial reproductive techniques. So, of course, there is availability of the practice of freezing the eggs for females and freezing or preserving the sperms or semen for males. Is this permissible practice without any reasons if someone just chooses to freeze it for their future use because they may or may not be able to father a child or conceive in that reason? That's one question. Second was, after in vitro, artificial technique, when they do in vitro fertilization and then they freeze the embryos, and they freeze multiple embryos and they implant multiple embryos as well. But there is some, if the conception happens and progresses unremarkably and uneventfully and baby is delivered, then there are some frozen embryos still available with the provider, fertility provider, or the practice. So what's the ruling about those remaining embryos? Is it permissible to then, what they call is, destroy it? Your thoughts on those ones? Jazakallah khair.
So in general, you try as much as you can to not get into these difficult situations and to avoid them as much as possible. But if you got into them, then it is permissible to destroy the frozen embryos, and it would be permissible to do reduction, in utero reduction, if that is in the interest of the embryos. Like, let us say you have 7 embryos, and this will cause, and it is determined, so that I'm not a perinatologist, it is determined that leaving the 7 embryos will cause harm to the 7 embryos, then reduction may be permissible in this case. Destruction of the frozen embryos would be permissible, because otherwise, if you don't, what are you going to do with them? And freezing eggs would be permissible, particularly if someone would undertake sort of surgery or chemotherapy or something of that nature, and they want to freeze their eggs. That would be permissible. But we simply say, but that also is a given, simply say, just make sure that there is no mixing, and make sure that you're not giving those eggs to anyone else, and make sure that those eggs will not be implanted. So if you have a frozen embryo, can you come back later and implant it? Of course, if the mother and the father are still married and they're still alive, both of them, alive and married, you can go back and implant those embryos. But if the father died, then you can't. Because you could freeze the embryo, and then after the guy dies by 12 years or something, have a child. So that would not be permissible. Yes?
Sheikh, where do we stand as practitioners in terms of having to give the differing opinions? So, for example, neutering of animals is there's differing of opinion among scholars, as far as I understand. Now, do I take a position saying, okay, I'm following a Hanafi madhab, therefore I will take this stand and I'm going to recommend this for anybody who comes to my clinic? Or am I required to, especially if, obviously it wouldn't apply to non-Muslims, but for for Muslims, do I need to say, look, if you come in, if I give advice about desexing of their pet, and I have to, am I required to say, look, this is the position of this imam, that imam, etc.? How much do we need to know as practitioners, and how much knowledge do we need to impart to our people to make their decisions?
So the question is composed of the several parts. So one part is it required of the Ammi to have a madhab? And the majority of scholars say al-Ammi la madhab lahu. If the doctor is also a scholar and they have taken it's recommended by the majority of Muslim scholars for the student of knowledge studying fiqh to study according to one madhab and to basically be instructed and trained in one madhab. And then they can study other madhab afterwards. But does the Muslims in general need to follow a madhab? The majority of Muslim scholars say al-Ammi la madhab lahu. The public or the lay person does not have a madhab. That's the first part of it. The second part of it, should the doctor force their madhab on the patient? If the doctor should not be forcing their madhab on the patient. If the matter is a matter of agreement, then you cannot, like a matter of agreement among Muslim scholars, like euthanasia, for instance, that's human euthanasia, is a matter of agreement among Muslim scholars, then it's not that you're forcing your madhab on the patient, it's you can't, because you can't violate the consensus of Muslim scholars. So in this case, you have to say to the patient, I can't partake in this. But you should be flexible enough to allow the patient to choose for themselves and basically to be flexible with your patient, allowing the patient to choose for themselves. So if some doctor, for instance, is Hanbali, and for them, impurities are not allowed. You're not allowed to use impurities for treatment, for medications, and your patient does not mind, then you should prescribe for them what they need or what they want, because the Hanafis and Shafi'is have allowed it. I wouldn't force my madhab on the patient. That applies also to spouses. You don't force your madhab on your spouse. That applies even to parent and child relationship. In fact, Ibn Hajar al-Haytami, Imam Ibn Hajar al-Haytami is one of the known Shafi'i imams. He said if a father demands of his son to follow his madhab, he doesn't need to obey him, because that, if it is not warranted, if it is not, basically for a sensible reason, is an act of foolishness.
As an extension of that, then, it's incumbent on us to know the positions of the different imams if we're going to advise on a topic, because if I only know my one madhab standpoint on this and I'm following that practice, how can I give someone an open opinion if I don't know the position of the other imam?
As a doctor, you want, just like the merchant, just like anyone needs to learn the fiqh of their particular profession. So as a doctor, you do need, we're not saying that you will study comparative fiqh in all matters, from salah to jihad, but whatever it is that you need to learn for your profession, you need to be able to have a little bit more sort of extended study of those particular issues. Yeah.
Assalamualaikum, Sheikh. So I just want to quickly touch base on your view earlier on about it's the patient's responsibility to choose what kind of doctor that they want. But what about the healthcare providers in the sense of the male doctors, for example? is it permissible, or what is your view on them, on having this passion in doing obstetric or gynecology, and very much similar to the female doctors who have got this passion and interest in doing urology. Because we know that if the male doctor is embarking the journey towards the woman's health, there will be 100% of their patient will be from the woman, where they're going to see all these reproductive organs of the woman. So I know that in the past, there might be shortage of the doctors that allow the men to become the obstetrician or the gynecologist for the woman's health. But nowadays, we do see a lot of female doctors. So in the current situation, what is the ruling or your view on the male doctors who would like to become a OBGYN specialist?
I would advise them against it, but I wouldn't prohibit it. I would strongly recommend against it, but I would not be able to say it's haram. I can't say it's haram. Because, women treating men and men treating women has been sort of a long-standing tradition throughout the history. And there are chapters in books. In Sahih al-Bukhari, there is a chapter about women treating men, in which he reports from Atiyya and Rubayya bint Muawwidh and Aisha that they used to go out to tend to the wounded. So I personally would advise against it. Like if my son wants to go into a specialty, I would tell him just avoid OBGYN. And of course, if my daughter ever wanted to go into a specialty, I would tell her avoid urology. It's like, but anyway, I just can't say it's haram, but I would strongly advise against it. Yeah.
Okay, we just had a question on Zoom as well about donation of sperm and then breast milk to neonates as well. What is kind of the Islamic ruling on that?
Donation of sperms?
And eggs as well.
And eggs? You can't donate sperms and eggs. No, you cannot donate sperms and eggs. There is no room whatsoever for donating sperms and eggs. It is haram to donate sperms and eggs. There is one scenario that is interesting that they had discussed at some point, but they came back and they just wanted to completely erase it from the records. Where like a man is married to two wives and basically having the egg from one wife and planting it in the uterus of another. This was a discussion at some point because they said that, because certainly like you can't have the sperm of a foreign man in the uterus of a foreign woman, but that triad here, some of the scholars, it seemed a little interesting, some of the scholars at least worth discussion, but they came back and said, no, it's prohibited. So they came back and said it's prohibited because it will cause, why is it prohibited? Causes confusion, like who's the mother then? Yeah.
And just to follow up on that as well, there's a question about donating breast milk for neonates in ICU and just to replenish neonates as well.
Breast milk?
Yeah, donating breast milk.
Okay, so breast milk banks, this is a little bit of a problem, and we have some disagreement, and some of the scholars, Sheikh al-Qaradawi, rahimahullah, he said it's okay, but I personally believe it is not permissible, and the reason why it's not permissible is that we don't know who's getting what, and breast milk causes tahrim for us. It's a very sacred thing. You truly become a mother when you breastfeed, give breast milk to your child, to a child. So you truly become a mother. So like a wet nurse or like a milk mother, a milk mother. So it's not unless Of course, to donate your breast milk to a particular child, I'm not talking about this, I'm talking about the breast milk banks, but to donate your breast milk to a particular child that you know or somebody that you will know, and you know from here on that this is your child, absolutely fine. You know, righteous, virtuous, may Allah reward you. But to donate it to breast milk banks, that's a little bit of a problem because they're unidentified, and this child, you know, breastfeeding, there is disagreement over how many times, but some of the madhahib, the Hanafi madhab for instance, you know, any breastfeeding will cause tahreem. So in the Shafi'i and Hanbali madhab 5 times, but even with this breast, like even taking that standard, you could still get 5 sucklings or 5 meals from one woman, and that woman becomes your mother, and you don't know, and then her kids become your sisters, and then it causes like a problem. So unless we have our own breast milk banks that we identify, that we know and designate and know who's taken what, and then inform the people of the sources, then that's a different story. Or if you know a friend who is unable to breastfeed and you donate your breast milk to her son or daughter, knowing that this is going to now be your milk child, then that's fine as well.
Hi, Moshe. Thank you for your talk. So by the same token, the other way, if there's a neonate and you're the parent of the neonate and you should breast milk bank.
I'm too old to hear you.
Oh, sorry. If you're the parents of a neonate who needs breast milk, but you can't find one breast milk mother who's accepting, can you accept from the breast milk banks where you don't know who the mother will be?
Can you accept if you're the issue here is like sometimes the doctors and the scientists in general, they hype things up a little bit, if you don't have the breast milk, like you can have formula, you can have different types of formula that will do, and oftentimes we used formula and there was no problem and stuff. But anyway, if someone truly believes that this is going to be life-saving for their neonate, then they can take the position of Sheikh Qaradawi. He said it's okay. You know, it's not a position that I believe in or that I basically promote, but it's a condition, it is a position of a respected scholar. So they can take it.
And we can just do one more question before moving on to the next topic.
Assalamu alaikum, Sheikh. Just wanted to ask about surrogate mothers and if some couple is permissible to consult a surrogate mother if the wife has hostile womb or if she has like really bad fear, like a phobia of pregnancy or anything like that, and if you are a Muslim, are you allowed to be a surrogate mother?
No, you're not allowed to be a surrogate mother. Yeah, we said that if a man had 2 wives, that was the only thing that they considered, that they thought about, and they even wanted to erase it from the records because it is a problematic proposition. And, so surrogate mother is a mother. And she may have feelings for that child, even more than the egg mother. So the mother who carried the child in her womb for 9 months, she may have more feelings for the child than the egg mother. And that would create problems. So I don't know of any scholar at this time who allows this. None.
Great. The next question is more from a medical student's perspective, just about student loans. So in Australia we have HECS, it's a government loan and it's kind of indexed every year, so it kind of inflates, you can say, it kind of, accrues interest in line with inflation as well. So a lot of medical students did ask about getting student loans to pay off their education as well. So just kind of the Islamic ruling there as well.
Islamic ruling on student loans, and you said that the student loan increases with so fixed interest or variable? What is
variable interest on they call it indexing here.
Okay.
To clarify, isn't it the indexing based on the CPI, the inflation rate only, not interest like the banks do on the convention? In the US, I think the colleges and universities would do based on the markup, but here it's on the indexing on the CPI, the consumer price index, that's inflation.
They're being nicer, but it's still a problem from an Islamic perspective. Anyway, student loans at AMJA we have basically a declaration maybe 15 years ago to allow student loans if they are needed, if there are no other alternatives, if there is no other way for people to finance their education. And that is based on Al-Haj al-Amma, which is public need. So if you, the scholars say that Al-Haj al-Amma تنزل منزلة الضرورة الخاصة. So a public need is treated like an individual necessity. So the public need of the community to have higher education, public need of the community to have higher education, is certainly a massive need, because education is of extreme importance, and if you disallow the Muslim youth from pursuing higher education, the sort of the collective harm that would ensue from this will be magnificent. So that's why we said it is okay, although we are stricter with other types of loans, the interest-bearing loans. But when it comes to student loans in particular, because of the great public need, it is okay. But then the students need to do their best. The students need to feel the heat of a usurious loan. They shouldn't take it easy. They should feel the heat, which means that they should take only what they need, really, really need, and they should pay it off once they can. And they wouldn't be traveling around the world when they still have a loan, going to Umrah every couple of months or stuff like that. No, you shouldn't. You should pay it off. It's a usurious loan. Yeah.
We'll just jumping into the next topic, just about Islamic research, just research as well from an Islamic perspective, because obviously there are lots of research done in fields where, conflicting fields where there's gender, sexuality, and then obviously termination of pregnancy research as well. So a few people have asked about what's the kind of Islamic ruling on being a researcher and participating in research in these fields?
Research is not a problem, because research in general is not a problem. It depends on if you're going to use like haram methods or haram, for instance, if you kill babies to do research on them, that's a problem.
I think to clarify the question, I think they're asking, for example, like clinical trials of different transgender surgeries, for example. So you're advancing the cause of something that is haram, like they're doing a clinical trial, this method for transgender surgery, this method for transgender surgery.
No, you should not do this, of course. No, like if the research is for something haram, then you shouldn't do it. But research in general is a noble field. But if it is like doing research on transgender surgery, then that's not permissible. Like someone will do research, for instance, on, wine, to be administering wine to different people, to see the effect of. That's not permissible for a Muslim.
I think just to wrap it up, kind of with all the topics that we had for today, a lot of, obviously as physicians as well, there are a lot of difficult conversations to have, and we have to be very careful with our words as well, with these controversial topics that collide with the perspectives collide with Islam as well. So just wondering, what kind of advice do you have to us as physicians and medical students as well when we're discussing these controversial topics, but also kind of balancing our Islamic perspective as well?
The advice is to basically to have integrity and honesty and prudence. Prudence will make you tactfully share your views and your values, which you will not force on the patients, particularly if the patient is not Muslim. You're not forcing your views and values on them, but you are sharing your honest sort of thoughts and convictions with them. And you should you encourage them, or should you basically encourage them to ask you questions? I think you should encourage them to ask you questions. If you're prudent and tactful and you know your stuff and you know how to speak, then it's a great avenue for da'wah. It's really a great avenue for da'wah. If you're a compassionate, prudent healthcare professional, it's a great avenue for da'wah. And you should encourage them to ask you, and you should solicit their sort of questions, but you should not force your convictions on them, and should not force your convictions on them, and you should also share your convictions tactfully, because خاطبوا الناس على قدر عقولهم أتحبون أن يكذب الله ورسوله. Speak to people in a language they understand. Do you want Allah and His Messenger to be denied or rejected? So speak to people in a language they understand, but the content that you're sharing with them must be aligned with your values, with your convictions and your values.
We just had a question online as well about the ruling on indemnity insurance and health insurance as well. It's a big topic.
Health insurance?
Yeah, and indemnity insurance as well for physicians.
So, just explain the two-tier system here, because in America it's different, right? There's only private. Just explain it for health insurance.
I think it will.
So health insurance, like in America, if you don't have health insurance, you're really in big trouble. Because in America, health insurance is considered, a necessity, because you'll really be in big trouble if you don't have it. I heard that you guys here have a private system and a public system, and people can get treatment through the public system if they don't have insurance. But I've also heard that the public system may not be. So the bottom line here is, because I would not be able to tell your haja, I would not be able to determine the amount of haja or need just by you explaining this to me in the next 5 minutes. So the bottom line is health insurance involves, it's a type of, it's like other types of insurance, it involves gharar. Gharar, so the things that would make a transaction in Islam forbidden would be riba and gharar and darar. So riba usually, gharar is excessive risk taking, which is like gambling in play. In transactions, the counterpart of gambling in play is called the gharar in transactions. So excessive risk taking. And then darar, which is harm, that includes a list of things, cheating is, etc. All of this under darar, which is harm. So the difference between something like riba, for instance, and gharar is that riba is not permitted unless there is a necessity, darura. But gharar is a little bit less prohibited than riba. It doesn't mean it's not prohibited. Certainly some degree of risk is acceptable and permitted and, no problem whatsoever. But excessive risk taking, such as in the insurance industry, you pay $20 a month, and then if something happens to you, you take $2 million. So there is excessive risk taking. How can we make health insurance Islamic? Very simple. Islam does not prohibit anything human beings need without having an alternative for it. Very simply, how do you make any type of insurance halal? Why is it a problem? It is a problem because it's a for-profit agreement between you and the company. I will pay you, you are the company, I am the client, I'll pay you $20 a month, and then if I get into a car accident, you will give me up to $3 million. That agreement this is a for-profit agreement between me and you. Although some of the scholars said this is halal, the vast majority of Muslim scholars said it is haram. Vast majority of Muslim scholars says haram because of what? Gharar, or excessive risk taking. What is the Islamic alternative? The Islamic alternative is to make you non-for-profit. If once you as a company become a cooperative insurance, non-for-profit cooperative insurance, then it's not a problem. Why it's not a problem? Because I am paying 20 and Brother Philip is paying 20 and Brother Shabazz is paying 20 and every brother here is paying $20, and put this in a pool and we put this together, and it's run by a company, but this company is non-for-profit, meaning employees who oversee this and who invest the money and who dispense the money and so on, but the surplus goes back to the insured, because the insured are the stakeholders. The idea of cooperative companies, co-ops. So the surplus goes back to us, and the deficit is basically covered by us. The surplus goes back to us, the deficit is covered by us. So this is a cooperative insurance. That's it, halal in this case. Now, but if you don't have that model, if you don't have the cooperative insurance model, and it is a conventional insurance model, is it halal? No, it is not halal. When does it become halal? If there is necessity, like riba, or just a need, not a necessity. But it has to be a significant need, So when it comes to health insurance in America, it's almost close to necessity. It's a very significant need. But here, I can't tell you if the need for you to have the higher tier, is so great, or is great enough, or is significant enough to allow for this or not. it just takes, a little bit more awareness of your conditions that I don't have.
Great, we might just wrap up all the topics there. And just, actually, there's one question on Zoom that I thought we'd address this one quickly. Sorry. So people ask, in terms of Islamic bioethics and us as physicians, are there any successful initiatives in the States that we could incorporate in our education systems and kind of bring in so that we have awareness for Islamic bioethics as well?
Oh, what is it?
Are there any initiatives that you're a part of in the States that we can kind of implement in Australia and in our little community groups as well?
There is Al-Balagh Academy in the UK, and there is Dr. Hatem in the US. They are very involved. I am not a bioethicist. I just address these issues from a juristic perspective. I'm not a bioethicist, but you have people who are really involved in this stuff are Al-Balagh Academy in the UK, and there are actually there is Sister Asma. I blank out on names nowadays. I'm just getting really old. Asma Mubinuddin, Dr. Asma Mubinuddin, and Dr. Asim Padella. These are known in the U.S. to be very involved in bioethics. But look up at Balagh Academy from the UK. They're also very interesting, and they have great initiatives.
There's also a Journal of Islamic Bioethics as well that Asma discussed.
So now we'll open up to floor questions.
Assalamu alaikum. As a cosmetic nurse or cosmetic surgeon, are you allowed to treat patient with the cosmetic surgery and all those injectables and those type of things?
Okay, this is another field that I don't recommend for people to get into, because they will run into problems. But in general, cosmetic surgery is not all haram in Islam. Cosmetic surgery that is forbidden by the scholars is when you change the creation of Allah unwarrantedly, like you don't have any problem, and you just want, you don't like the shape of your nose or ears or something, but there are a lot of cosmetic surgeries that people think are haram and they are not haram. So if you have a sixth digit, for instance, or Botox, Botox is not necessarily haram. Even if you're doing this to stay youthful, it's not necessarily haram. Do we advise it? No, I don't advise it, but it's, you just can't say it's haram, because it's not changing the creation. You're trying to fight off age. You can't, but But anyway, so there are many cosmetic surgeries that are completely permissible. Of course, someone who suffered from a burn and someone who does have a deformity, all of those things are halal, halal, halal. It's just that cosmetic surgery that our scholars are against is when people don't like how they look. They look normal. There's nothing outside the spectrum of normal human variation. And from an Islamic perspective, from an objective perspective, the Prophet ﷺ wanted people to be content with the creation of Allah, wanted people to be grateful to Allah and be content with His creation. And he said, كُلُّ خَلْقِ اللَّهِ حَسَنٌ. كُلُّ خَلْقِ اللَّهِ حَسَنٌ. So he saw a man who had his garment was going down all the way, and he said to him, raise your garment, lift up your garment, because it was going down below his ankles. And then he said to him that he has a deformity in his legs, and the Prophet ﷺ said, كُلُّ خَلْقِ اللَّهِ حَسَنٌ. All of Allah's creation is beautiful. So he wanted us to be accepting of Allah's creation and not chasing, sort of a particular type or like a particular, you know, anyway. Now, since many people actually do this, they want to change their looks in a way that would not be consistent Islamically. I would avoid that specialty, but as I said, you know, if someone is already in that specialty, then ittaqullah mastata'tum, fear Allah as much as you can, and you try to find within that specialty like an area of like subspecialization where you will be treating people with burns, for instance, or you will be treating people who actually have a legitimate need for cosmetic procedures. Yes, Allah yabarak feek. Yes.
السلام عليكم ورحمة الله. ألف شكرا وجزاك الله خيرا. فزد في علمك وفي عمرك. I have a question that since I have heard that Al-Haj min Sunnat al-Nabwi, then how can we say that sometimes it's obligatory and sometimes it's recommended?
The treatment, seeking treatment?
The treatment for the sick person. While at one place it's the Sunnah. So actually acting upon a Sunnah, it has its own benefits.
So seeking treatment, is it obligatory or a sunnah?
Yeah.
Seeking treatment is a sunnah by default. But if you have a harmful disease and a safe medicine like insulin and diabetes, like TB and whatever treatments you have for TB, a harmful disease, a safe medicine, then we would use the hadith of la darar wa la dirar, there should be no harm or reciprocation of harm, and tell you, take your insulin, because if you don't take it, you'll suffer from, you know, like bad complications. Don't harm yourself. The Prophet said, don't harm yourself. He said, la darar wa la dirar. Wa iyyakum.
Assalamu alaikum, Shaykh.
Waalaikum.
Just one last question. I was curious to know, just touching back on earlier when you were speaking about transgender and transitioning, you said that it was impossible to revert to another gender completely. And so if you know someone who is transgender and has already undergone gender-affirming surgery or hormonal treatments, and now they are interested in pursuing Islam and wanting to practice it, do they practice as a woman or a man, or should I refer them to someone else?
If they want to practice Islam, should they practice it as a woman or a man?
And like pure intention on their behalf, they believe in Allah and everything.
Okay, I have been talking to several transgender people, by the way, because keep in mind, at the end of the day, these are souls that are still, the gates to heavens are not closed before anyone until they leave this life. So we have to basically talk to them, and oftentimes when I talk to them, I find that people who are really sincere, like they convert to Islam, for instance, and they really want to be good Muslims, they follow the rules, they obey the rules. What are the rules? Islam does not recognize change of sex unless they have a biological, sort of underlying biological condition. But if they did not have an underlying biological condition, Islam does not recognize the change of sex. So they want to go back and basically live based on their birth sex. Now, what are we going to do in situations like masajid and so on and so forth, and lining up for prayers if they have already if they have the features now of the opposite sex? That's a long discussion. If you have time. But generally speaking, what we want to remember is that Islam does not recognize the change. They are the sex that they were born in, because if you're XY, you will never be not XY.
Sorry, any last questions from the floor? And then we'll wrap it up. Okay, we'll just thank Dr. Hatem today for solving through all our questions today. We've got a token of appreciation from Sheikh Sahib.